Hey guys, I wanted to do a quick tutorial about why students should read their textbooks to succeed in nursing school. It's something that I've always talked about, but I guess, when you say it, it's not always believed, and not everybody follows this advice. So I was going to make a quick little video to better explain myself. So there's a whole rationale as to why even to make a video, why bother to make a video, and I'll get to that in a few minutes. But what is learning and what is it to know something? What exactly does that mean? Well, let me tell you that this is what my master's degree was in, and there is theory after theory after theory of what there's people who've argued their whole lives about what this means. So let's not get too much into this, but if I could boil down my master's degree, which is a master's degree in nursing education, is if it's not being measured, then it's not learning. So let me write that down for you. It has to be measured. So as far as it's going to be considered learning at an academic level, at least, it has to be measured. That doesn't mean that you can't learn something on your own, but as far as academics is concerned, if it learning doesn't happen unless it's measured. And then the same thing for nursing too. When you teach a patient, you don't say that the patient learned something unless you measured it. So unless you ask them a question or test them somehow, it's not learning. And you can think of this as if you were to hand somebody a brochure, that does not make you a teacher, right? Uh, because they can throw their brochure in the trash and they didn't learn anything. And the only way to uh, make sure that learning is being measured is by assessing the learning. So there's all different kinds of knowledge, and we'll get to a little bit of what exactly does that mean. Well, this is the whole kind of purpose of the video, and why I had the idea to make the video is that there is only one real adult learning theorist. The rest of the learning theorists are theorists who talked about children learning. And there's one guy, his name is Knowles, and you can remember that like Beyonce Knowles, is he says that adults learn differently. So one of the first things that Mr. or Dr. Knowles, I'm not even sure what his credentials are, is that adults must find their knowledge relevant. If it's not relevant, you're not going to learn it. You can think about that in all different things, right? If it's something that doesn't interest you or you don't think it's relevant to your life, why would you bother learning about it? So the other thing is that adults bring in their experience to learn. Okay, that makes sense. So if we're talking about cars, and I want to talk to you about driving cars, you're going to bring your experience about driving a car into the classroom before we've even started class. You already have that knowledge and your personal experience of driving in car or driving cars, or at least riding in cars, right? Everybody, I think most people have done that, and you're going to bring that with you, and you're going to base your new knowledge in the classroom based on that experience. That makes sense. And these are just all my synopsis, okay? So, and this is the other thing that I've taken away from the adult learning theory is that adults need learn better and learn more in a relaxed learning environment. So that doesn't mean that it's 100% no rules, but to me that means more that adults are less likely to learn something under pressure, under stress. So I really do take that to heart. Um, Sometimes I take it. In the past years, I've had to learn to dial it down a little bit as to how relaxed I can be. But I really do believe this that something will stick more in my classroom the more relaxed that I am. And again, that doesn't mean that I don't have any rules or it's a free for all. But I do want to stress that I am trying not to kick you out of nursing school at any moment's notice, because I firmly believe that people do not learn that way. So this is another theorist that has to do with you and nursing school, and how is this relevant to anything too. So DACC nursing follows the scaffolding learning theory, and this is something that we report to Board of Nursing and to ASIN, our accreditors. And one of the famous theorists is called Vygotsky. But in it's a pretty simple. I mean, I think it's a pretty simple theory. It can get very complicated, and there's lots of papers on this. But that's my washer. But what that means is people learn in a scaffolded way. So if you think of it as a staircase, oh, sorry, that's a highlighter. If you think of it as a staircase, we learn basics at first. We learn our basics, and then we keep elevating to more complex concepts. And I think most education in schools are based in that concept, right? You learn your ABCs and your one, two, threes in kindergarten, and then once you learn those ABCs and one, two, threes, you start getting into more complex. And if you think about reading, reading follows the scaffolding, right? At first, you learn the words, and then you start with picture books, and then it starts going into chapter books, and then more and more and more. And the same thing happens in nursing. So let's talk a little bit more about how exactly that happens. This kind of relays into it. Now, this is Benner's theory of novice to expert, and this is a nurse theorist, and it has to do with education a little bit, but it has to do with nursing experience and nurses. And we follow this too. And let me play for you a little bit. You can look this up, and again, there's lots of papers on this, and it gets really more complex about it. But I wanted to show you just one of the web pages that I found on it, just Googling it. And her name is Patricia Brenner. She's a nurse, and she's got a theorist that's all her accomplishments and everything, if you ever doubted who she is. Um, and basically, there's 5 levels of nursing experience, right? Let me stop that for a second. So here are the 5 levels of nursing experience, right here: novice, advanced, beginner, competent, proficient, and expert, right? Um, and there's little blurbs as to what each one of those means, but this is how we base a lot of our stuff, and Board of Nursing uses this to, we talk about Benner and where we want our students to be. So would you be surprised if you learned where you were here? Where do you think that we want you to be by the time you graduate nursing school? You're you've graduated DACC, you've taken your boards, and you've got a fresh nursing license. Well, if you look at this right here, you can see that even competent, you're not even competent yet, because that would require you to have 2 to 3 years experience on the job in the same area. So this is where we want you to be when you graduate, an advanced beginner. Um, so it stands to reason that we don't expect you to be ICU or hospice experts by any stretch of the imagination. We're just trying to get you to be safe and at least on your path to being competent in your 1 level. And the reason is that nursing branches off into so many expertise that it's hard to teach you to be experts in all of them. We want you to have a foundations of nursing for all of them, and to know everybody in your class. We're going to have nurses in hospice, nurses in med surg, nurses in ER, and all go through the same nursing school, but have that fundamental knowledge and learn to be experts in your own field. Well, that's a lot. And you might be thinking, well, okay, well, that's kind of interesting, but I'm not sure how any of that is relevant to me or what I'm doing right now. Well, let's talk a little bit about that. And this is you right here. This is you right here. And before you've even come into the door, you've come in with some basic knowledge of some things. I mean, that's what the prerequisites mean, is that you're bringing forth this knowledge. So you've come in with like AMP. That's my highlighter again. You've come in with AMP, right? Maybe some biology, English, math, uh, different sets of knowledge that you've walked into. This is the door. That's my little door. You before you've even walked in the door, you've come into my class with this kind of knowledge. And this is us. This is the nursing instructors over here. Uh, that's I tried to make a little graduation cap there. Um, you take this knowledge that you have, and we're going to start to build on top of that. So this is the book that you're reading, right? And if you've come in reading that book, so you might come in with some knowledge about how the heart works because you've taken AMP as a prereq and you've successfully passed that course. So we can assume that you know certain things without even me having to test you. I can assume that you know that the heart pumps blood, right? I think that would be a pretty good assumption. I don't have to test you on that. I just assume that you have that knowledge. And so I'm going to show you the skill on how to check for a pulse. Now, I don't have to explain to you how a pulse works or where that pulse is coming from. I'm going to go straight into this knowledge here and show you how to take a pulse and the different places to take a pulse. And it's going to keep going like that. It's going to all these different foundations of all, and that's why your class is called Foundations of Nursing Practice, is because you're getting a fundamental building blocks of how everything works. Now, and if you think of this in the same way, when you come in to class and you've already read the book about how to take a pulse, and okay, you got a good idea, and maybe you can practice on yourself, but you're not sure how to practice on somebody else. So, or maybe somebody else's pulse is different. And that's where I come in, or Rosa comes in, or Laura comes in, or Mary Beth comes in, and we're going to give you our experience and how to find different pulses, our experience, how to better count, our experience on how to find respirations. And it's you take that knowledge and you take all of this combined and you go up to the next level, which is experience. And once you take all this knowledge, you go and you try to take that into clinical or to a family member and you say, Dad, let me try to take your pulse. You start to formulate your own skill in here. But if you come in missing, I'm trying to erase it, but it won't erase. Erasing, you come into class without having zero idea about how to take a pulse. Well, then our little spiel is not going to be very effective because we have some data missing. And we're trying to get you to more higher levels to do that. And this goes straight for every single class that you're going to have in nursing school. As a matter of fact, for most of your classes as you progress, and I hope that everybody gets their bachelor's degree, but you're going to need to at least read and skim and have a basic idea of what's going on. I don't want you to be the pulse taking expert way before you come into class, but you do should have a general idea of what's going on, and that's where you need to have it. So once you have some of these, what's going to happen in your next semesters is they're going to build on these little building blocks right here that we've taught you in Adult Health 1. they're going to assume that you know how to take a pulse and take a pulse correctly because you've passed my class, and that's a prerequisite for Adult Health 1. And we're going to build some more on that skill. And we're going to start talking about, we're teaching right now in our skills class the basics of well patients. Normal is another one you might hear. Well, we don't like that word too much in nursing. But when you get into Adult Health 1, you're going to start to learn what an irregular pulse is like, or a murmur, and all these things that can go wrong. And you might get some of that stuff too in clinical. I mean, they don't usually put in healthy patients into the hospital, right? But you start getting these building blocks as to what it could mean. And you start, remember we're talking about benders, you start to recognize certain things. So you start to recognize, you start to see a patient who's breathing at 40 respirations per minute, right? Now you start to think, hey, there's something wrong here. And we're going to use this word. You're going to start to recognize that something is wrong. So we're going to keep building and building and building on that. Adult health too. Mother baby. In mother baby, for third level, we're going to assume that you know all those things. You know about surgery. You know about pre and post op, más o menos. Because guess what? We're going to build on those things. So it just keeps progressing all of it. And then finally, at fourth level, it's kind of like what it's like an overall review of everything. And there's a class that has a like an NCLEX review, but it's not. Some students have thought that that's nursing skill in nursing school in 8 weeks, and it doesn't really work that way. We're going to start to touch on all these concepts that you've had building up there and give you kind of like a refresher. Hey, remember, this lab is off, and hey, remember when mom is in danger when X, Y, and Z. And that's what it's really going to be about. When you graduate and you get your license, you're going to have this basic and vague idea of different things and what it can and cannot be good or bad for your particular patient. So, what are the pros and cons to this, and what are the pros and cons to reading? Well, I think everything has strengths and weaknesses too. Um, Simply reading on your own and not coming into class and not listening to lecture only gives you a certain piece of the picture. And I've seen students try to do this and fail. Um, there's a reason that we're there, and we're there as instructions, and we're not just here, hey, read these books and then come take the NCLEX. There's a lot missing in there. So it's not the be all end all by any means, and nor is lecture. Just coming into lecture should not be the be all end all too. You cannot get the full picture and the full learning that you're going to need just listening to my lectures or just watching the demos of the videos. So the pro about it is there's a consistency. There's a consistency, no matter whether, so say for skills, if you read the book on a specific skill, we've been talking about taking a pulse, your classmates have read the exact same book. You can discuss with them and talk to them more about that one particular skill and what it says in the book. Whether you've come to Laura or you've come to Rosa or Mary Beth or me, that book we're still going to refer to that same book. Or you go to Ben to Open Lab and you start talking to him about it. You can pull out the book and start talking about this same skill in that same specific area. And no matter what happens, you always have that basic foundation for that. So that's what I think I love about this. And no matter, what kind of personalities, we all have different personalities. Instructors have different ways of teaching. So, and we bring different things to the table, right? So I can tell you how to take pulses in babies and kids very easily, while Laura can tell you how to do them in adults. So not that I can't do it in an adult, but we just have our strengths and weaknesses, but no matter what, we still going back to that same book. So just as a quick review, you need to be a walking, talking sponge when it comes to the different kinds of knowledge and things that we're going to teach you. And there's a lot more that gets into it, and the different kinds of questions and test questions we ask you. It's not straight knowledge. You know, a lot of people think that it's that way, but it's really more complex than that. For example, the straight knowledge question is, did I teach you that the sky is blue, right? So let me write this down. You know, the sky is blue and 1 plus 1 equals 2. Those are straight knowledge questions. You memorize that. You don't question me. You don't ask me why. But as long as we start getting more complex as to the whys of something happens, that's what ASIN and NCLEX and all these governing bodies want you to know the why. So if you can recognize first that a patient with a respiration of 40, that's something to look at and to figure out why your patient is breathing that way. You start to troubleshoot, and that's a different kind of knowledge, right? So I don't want to get too much into that because that's our level. And so we're going to start asking you more and more complex questions as to building on those foundations that you've already been learning. But I wanted to tell you some basic things and basic hierarchies or priorities for your nursing patients that I've learned in almost any nursing area, any clinical, whether you're in the NICU, whether you're in the nursing home, LTAC, it doesn't matter. Here are the things that you need to look out for. Where's this one? Here are your highest priorities, especially in nursing school, and they're going to get more complex. You are responsible for way more than this, but in nursing school, you are responsible for ABCs, pain, and safety. Now, this is Professor Soto's hierarchy, and I've had some uh, arguments with me about this little priority list, and nobody's really won that argument. But because these are the ones that you always get tested about, and everything will be higher than this. Now, there's way more, of course, way more priorities, in the grander scope of things when you start thinking about, but you're not gonna reach that level until you become an expert in your field for that patient and start to think long terms. In the meantime, you can really smoke out if you can focus on these things. If there's anything that affects your patient's airway, breathing, and circulation, if there's anything that affects your patient's pain, if there's anything that affects your patient's safety, if there's anything that's going to, so here's another word, here's another keyword for you. You need to be able to predict any potential problems. Nurses are responsible for prevention. You'll hear that word a lot. It's not enough that we treat an injury, it's just as important that we prevent and predict possible injuries or possible catastrophes that might have happened. So always try to remember those things. And if you can focus on these a lot, these if you're not sure where up is down, and you can always find something of this. Every single patient in every single hospital is at risk for falls, but for different reasons, right? If a neonate, a 1 week old neonate is at risk for falls, he's going to have different reasons, different interventions than your 80-year-old COPD with Lasix in the med-surg unit. Both patients are at risk for falls, but you as a student are going to figure out what things are you going to do to prevent it, and and the different interactions and actions that you're going to have with these patients. So if you can always try to come back to those, these will get you out of some trouble. I hope this helps, and I hope that you come into class read with, we would expect you to have questions. We don't expect, again, none of us, none of the faculty expect you to be experts in any of the things. We're here to teach you. And we need you to meet us halfway by doing your research and reading. And, everybody's going to have different levels of reading. Some of you are going to read something and get it once. Some of you are going to be like me, who need to read it 2 or 3 times sometimes to actually get it, and then maybe even then do it, and then maybe even watch a YouTube video to get it, and then I kind of feel like I got it. That's me. That's who I am. So I hope this helps, and I hope this gets you to better learning and even higher grades and more success. And I really do want to see each and every one of you with a graduation cap on, and be there at pinning for each one of you guys. All right. So talk to you later. Let me know if you have any questions.